Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Kirbie Chaisson, Director of Employer and Consumer Health at Terrebonne General Health System, who will discuss with us today the importance of corporate wellness and executive health. Welcome to the show, Kirbie.
Thanks for having me, Rhonda.
Well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
My name is Kirbie Chaisson. I'm the Director of Employer and Consumer Health here at Terrebonne General. I've been here for about 9 years. Came into the role as wellness manager and then just kind of got into the director field and did a couple other things around the hospital. My role here is to pretty much make the community aware of proactive approaches that we take, going out and educating them on annual wellness screening, age, gender-specific testing, and just keeping the community and the employers healthy.
Tell us about the programs and services offered by Wellness for Life.
Wellness for Life has a variety of wellness programs. When we first started here, we just had corporate wellness. We expanded that to, I would say, probably close to 10 programs now, with some of them being corporate wellness, executive health. We offer a sudden impact program. A lot of our programs focus on infants all the way to that working population. So all of that age range is included. We also have our Terrebonne General Mobile Care Clinic that goes out to underlying areas to provide health care to them and those areas in need. We have our Core Fit Safety, which is for our older population. We also have core seat safety checks for our infants as well and those toddler age groups. We also have CPR certifications that we do out in the community, and then a vaping education and our Super Sitters program that's actually going on now for babysitter certification.
So a wide range of community education.
Lots, and we're always trying to expand and offer new services.
Let's focus in on corporate health, corporate wellness. Can you tell us more about that program?
Absolutely. So this is one of the first programs we started when I came on. Corporate wellness was brought on to be a convenience to the employer and the employee to provide on-site wellness screenings for those employees who can't take time off of work to have their wellness screenings done. During that program, it also helps the employers to decrease their insurance premiums, also allows to have an increase in employee morale because they see that they're actually doing something for their employees. Also increases productivity. So as your employee is feeling well, they can produce more for you. Included in that program is mainly our basic screenings, which is a lipid profile, a lot of cholesterol testing, a glucose screening, blood pressure checks, a body composition analysis on our InBody 270 scale, and we also bring an NP or an RN out, nurse practitioner or RN consultations done.
So it's pretty comprehensive.
A very comprehensive, which can be done in 15 minutes per person.
Right. And then y'all even go a little further and offer executive health. Tell us more about that program.
So our executive health program is more of an extension of our corporate wellness programs. So those executives or those busy professionals who can't take time off of work for multiple testing, then we provide a service that's more of a 2 to 3 hour service to have all of that age gender specific testing for wellness along with the imaging included in that to be completed in 2 to 3 hours rather than multiple appointments on different days. This is more of a VIP service. We actually do a backdoor service where we have a concierge that walks them through the entire process. With that being said, they are brought in, no wait time, everything, almost all testing is, and lab results are done and given to them same day as well.
How very convenient.
It is very convenient.
Very, very convenient. So how does the health of Louisiana people rank?
Well, Louisiana is not very good in their rankings. We like our food, obviously. A lot of nutrition needs to be involved in a lot of our wellness programs. Louisiana is ranked the 50th out of 50 states. Our blood pressure is ranked at 45th, with 40% of our population having high blood pressure. Diabetes is ranked 44, with 15% of them being diabetic. Obesity, of course, is 49th. That is 40% of our population that is obese, and Terrebonne Parish actually has 41% of our population that's obese. And then cholesterol is ranked 40th, with 38% of our population having high cholesterol.
And all of those, do you call morbidities? I mean, affects people's health, right?
Comorbidities, correct.
Yeah.
And so those are things that are actually diagnosed. Our job is to go in and find those people that are unknown and undiagnosed in between that 20 to 40-year-old range.
Why is it important to get an annual wellness screening? What is the benefits of that?
The benefit of that is to add convenience, and also to find those individuals that don't have time to take off to have their annual wellness screening, but also those that are unknown. We are finding multiple people that did not know they were hypertensive, did not know they had prolonged high blood pressure, and then having them monitor that and see their PCPs. We're also seeing people that don't have a primary care physician. We're finding that being able to establish that relationship for them as well.
So doing these screenings helps them to identify things that they didn't even know that
Absolutely.
they had. Well, what are some of the findings that you're diagnosing?
We're seeing a lot of high cholesterol, uncontrolled cholesterol, high cholesterol as well. Those people that may think that, they want to do it by diet, exercise, which we do promote, and that's our main thing to promote. But some people have to be on medication. So we find a lot of uncontrolled cholesterol. We find a lot of uncontrolled hypertension and uncontrolled diabetes. We also find a good bit of unknown diabetes and unknown high cholesterol as well. And we're finding that more in our younger population.
Interesting. Well, this sounds like very important subjects, and I'm sure people want to get in touch with you. How can they get in touch with you?
Oh, they can call our department, Wellness for Life department, and one of my Wellness for Life team members, which is based on a lot of nurses, RNs, and MAs. They can call us at 850-6217, and then they can also email us at our department email at tgwellness@tghealthsystem.com.
All right, Kirbie, thank you so much for being on the show today and sharing this helpful information.
Thank you.
For more information on corporate wellness and executive health, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.